सो आपको राइनोप्लास्टी किया था और क्या क्या और कुछ नहीं किया था हमने, सिर्फ राइनोप्लास्टी किया था लास्ट टाइम और सेप्टोप्लास्टी, हाँ बकल फैट पैट किया था। हाँ अब करके 6 months हो गया है,
7 months हो गया।
हाँ या कैन यू शो द you show or one of you just show, no? Okay, single cut on the pin again. हाँ first front अगर के okay right। मेन आपका आपने बोला था पहले कि आपका एक ब्रीदिंग डिफ़िकल्टी था लेफ़्ट साइड से, वो अभी नहीं है?
नहीं,
बिल्कुल नहीं है। और आपका ये रिवीजन राइनोप्लास्टी था जो हमने किया था आपको, तो उसके पहले आपने बताया था 9 साल पहले एक बार सर्जरी आपने कराई थी।
yes,
और उसके बाद ब्रीदिंग डिफ़िकल्टी थी, अब ब्रीदिंग डिफ़िकल्टी नहीं है, बिल्कुल नहीं है ना? ओके वेरी गुड। और अब जो है मैं आपके नोज़ में, हाँ ठीक है, ऐसे देखिए साइड व्यू भी अच्छा है, नैरो हुआ है, हाँ ओके ऐसा देखिए प्लीज़। सो प्रोजेक्शन काफ़ी इम्प्रूव हुआ है। आपको मिरर चाहिए?
नहीं सर।
So I can explain. No need.
Sure.
Get a mirror for him, no please. Because subtle changes are there.
Yeah.
So I want you to see that, so
Sure.
you'll understand how all of those things have taken.
But
And
there's a slight issue with the nostril, so if you see there's a
I
head
saw
nostril
that.
difference.
I'll just see that very minimal. I'll tell you that. So you can see the look inside the mirror only.
Yeah.
So the tip was drooping.
Yeah.
So it has gone up. We've got a nice tip in the midline now.
Yeah.
And then the dorsal, you see there was that was also gone.
Yeah.
And there's still a little bit of swelling, because
Yeah.
it's not,
I can feel the tingling sensation.
yeah, it's not yet pinchable. So I think there's still a little bit of swelling left.
Yeah.
And this is the side view. And you can see the improvement in this angle, improvement in the tip, improvement in the dorsum. All right, so this is a patient who's come back for a revision, but also for some other procedure.
Genioplasty.
So he's come for genioplasty. We did a rhinoplasty with septoplasty, which was a revision procedure before, 7 months back. And so we're going to start with the scan now because it's more than 6 months. And genioplasty को मैं last time आपने नहीं. Okay, we have to do the measurement for genioplasty. I've written it,
Yeah.
but I have not done the measurements on the scan because I think you said नहीं करना आपको. So we'll do it now.
So that will improve the breathing as well. It will
Yes,
be like
it will improve. More than anything, it will make your face
more proportionate.
very very proportionate. And now you have a nice nose, which is like really lengthwise देखो ना बहुत अच्छा है, लेकिन ये काफ़ी retruded है. So I'll tell you how much of vertical augmentation also we have to do.
Sure.
And when you do that, this will come down also.
Yeah.
This will come down, this will come down.
Sure.
Okay, that I'll tell the plan as to कहाँ पे cut करना है.
Sure.
Most likely it's going to be a little extended one. यहाँ तक cut आएगा.
Sure.
यहाँ से.
Sure.
ताकि ये जो है ना ये भी push बाहर आए.
Okay.
And at least 1 centimeter, शायद ज़्यादा. Not less than 1 centimeter, because side में जब देखेंगे ना, it's really retruded for you. So only if it comes forward, you'll get that strong.
And it will become more longer as well. Like.
I think you have to get little vertical height.
Sure.
And more projection, both.
Sure.
Only then that'll look nice. Okay, so when would you want this to be done now?
Maybe tomorrow if possible.
Tomorrow if it's possible. Okay, we'll try to do it. The first thing I need is a scan again, unfortunately,
Sure.
because 6 months have expired. Have passed since the last
Sure.
procedure. So we'll take a scan. I'll do the measurements. We'll get back again. I'll tell you the measurements.
Sure.
Then we can plan tomorrow. Timing tomorrow I'll let you know a little later.
Okay.
Because we have a couple of patients scheduled.
Sure.
In case something happens, day after. In case.
Sure.
But worst come worst, we'll try to do it. You've come with someone else or?
No, I'll come along.
Or this time you've come alone? Did you contact the same first number for appointment, or did you contact the review number for appointment?
I contacted the same number, sir.
The original number itself. It's better to contact the review number whenever you are already patient.
No, I think I like chatted with both the numbers.
And then okay.
Yeah.
All right. You first order scan it. I don't think we need blood tests.
Sure.
Because we've done a major surgery and 6 months ago.
Sure.
And just a scan for me to plan the exact thing. I'll let you know. And that's it. And I'll tell you the timing also a little later.
So once I can wait for a day, like it can happen in the morning, like.
So day after tomorrow morning. That's better.
I'm alright for that.
Then we'll plan day after tomorrow morning such that you get a day.
Sure.
We'll finish everything. I only need your scan. I don't need anything else. So you give your scan and you're free for a day and a half.
Sure.
Come back only day after tomorrow morning.
Okay.
I'll tell you all the details today itself.
Okay.
Fatafat. Aadha ghante mein I'll tell you. Because I'm free right now.
I'm looking for the scar removal as well, like these ones, the forehead one, the nose one.
Show me which ones. It's pretty bad. Then I can. That we can do depression.
Yeah.
Small one.
The nose one as well.
Oh wow. Nose
So
one.
this one is like when it gets heat, it swells up. That's the main issue. Like it changes
nose
shape. It
one.
changes
Last
color.
time also you told me.
Yeah.
I remember.
Yeah.
Nose one. Okay. This time maybe I'll do.
Yeah.
This one I can give you a good result.
Yeah.
The depression will go away. You'll not see
And
a
this
scar.
one as well. So this is like I got the mold removed, but it still is like there.
Okay.
Yeah.
This also will get good result.
So this is the main one. So it's just on the nose. It's more common.
That I don't know if I'll be able to totally, because see, it's thick,
Yeah.
which means it's a little hypertrophic scar.
Sure.
So these are all, see, if you touch,
Yeah.
that's what I'm saying. If you want, you can wait for this also.
Well, because sir, I'll be going back, so that's why I don't have. I
Okay.
don't think so. I'll be coming back then for a year or two.
Okay, then we'll do.
Sure.
I think there will be improvement, but maybe the improvement will be better for this one and this one than this.
Sure.
Because that's a little thick when I feel. Check the scar or scar continue.
So will this will be fixed as well, like this made even because I wanted like this
little bit. It is.
because there's like a lot of a difference. It's more bigger and this is
A
more
little
smaller.
small.
Yeah. So
I'll try to adjust this side.
Yeah, this side.
A little bit,
Yeah,
okay?
Yeah.
For the nose thing, we won't charge you. For the other thing, he will tell you the costing and we can plan day after tomorrow. Naale kalichu kalla appointment kudutru. So you're going to have nothing on the morning that you come here, which is day after tomorrow.
Sure.
Fasting, no liquid, nothing.
Sure.
Come here by 9 a.m.
Sure.
and we will do it first for you at
Sure.
10 a.m.
Thank you, sir. Really
All
appreciate
right.
that. Thank you.
Done. Take the scan again. I'll meet you if possible today itself.
Sure.
So we can plan and I'll tell you कितना millimeter आगे पीछे क्या क्या हो रहा है, क्या expectation सब कुछ. And when are you going back?
Maybe after 5 days. 4-5 days.
Yeah, if possible extend.
Yeah, I booked the flight for 11th. 11th.
It's about a week.
Yeah.
But today is 3rd. We're doing on the 5th. 11th, what time are you leaving?
I have a flight at 12.
So about morning time, 6, 7, 8, 9, 10, 11. I think we should be good 6 days. Fair enough. 6 complete days we get. Good.
Thank you.
Yeah, you're welcome.
Here we have with us a patient who is back again for another surgery. He's undergone a rhinoplasty procedure 7 months, right?
7 months, yeah.
Yeah, 7 months ago. And today we have him here for a genioplasty and a scar revision surgery. So as you see, he has multiple scars, one over the forehead, here in the near the malar region, and also over the nose. So these are the 3 scars we are going to repair. He also seems to have a, can you look that side, sir? Yeah. So he has a receded chin. So we are going to do augmentation both in the horizontal and the vertical dimensions and give him a nice profile so that it suits his facial proportion. His facial proportions are even, and we will show you the post-op results shortly.
Treated with this chin augmentation via bony jaw surgery. Genioplasty was an extended one, and we've corrected or improved the facial proportions and made his chin more masculine and more proportional. Now we're going to show you how he looked now. The chin was really short and stubby, and he also had double chin. So we've corrected all of that and try and show you in the same view. Okay, so now we're going to show you this side. So we augmented it by 12 millimeters in the horizontal dimension, about 4 millimeters in the vertical. Hi. Yeah, looks good. So I've not done a great vertical augmentation for you, okay? I mean, I've done a little bit, but mostly, sorry. This is the worst bit of surgery. Okay. You saw all your scars also? So we've done genioplasty with jaw sculpting for this guy, Kanyakumari, and it was done how many days back? 5 days pehle?
100.
So 5 days before. இந்த பக்கம் சரி. That was like something. Yeah, 1 second. Okay, bite. Keep it closed. Alright, so you can see the improvement. Yeah, this huge improvement in the facial proportion. Now, you know what? There's still a lot of swelling.
Yeah.
It's going to come down for you.
Sure.
So this grooving will come up. This is just see inside. This is called the mentolabial groove.
Sure.
This will get exaggerated. This will reduce about 10%, 3-4 millimeters. There will be some reduction in swelling in the
So
sides
there's a
also.
reduction in vertically, like
Every way, even horizontally, it will reduce a little bit.
Sure.
Because there's still a lot of swelling for you.
Sure.
But the overall proportion of your face will be much more balanced than how it was earlier.
Sure.
You can see the side view. Look at that side. Look at this way. Tarida. So you can see the improvement. And then this view. You're very, very short chin, and it was like a concave profile. So that has been really augmented, and then once it heals, it'll be nice. In fact, this is probably going to make more improvement in your facial balance than your nose eventually. And we've also removed these scars, you can see. 1, 2, 3, 4. I don't think that should leave any big mark. It should be fine. Take good care of the genioplasty segment.
Sure.
This is something you will apply every day, 2 times a day as a protection to make sure you don't get infected. And I will also put you on some tablets which you will take regularly. And remember, it will take 4 weeks for it to heal. The sutures might be there for about that same time.
Sure.
A little bit aage piche. Once the sutures go away, everything is fine. Alright. So for the next few days, again, soft, solid, liquid diet. After a couple of weeks, you can get back to near normal food.
Sure, sir.
We've got another number here
Sure.
for your follow-up. You already know
Sure.
since you were here. So just send us your picture, how you're healing,
Sure.
and everything.
So they haven't removed these sutures, sir, yet.
Yes, we will take them off. They're very tiny, I've put, and also we've used rapids. So maybe you can just let it remain. We can let it remain, I think. We'll see.
Sure.
And how was your experience with genioplasty compared to rhinoplasty?
Yeah, it was like both was same, like
But which had more pain, rhinoplasty or genioplasty?
a little bit of genioplasty, especially while removing this fat.
Yeah, that is there. No, that I
Yeah.
totally agree. Because with the rhinoplasty, we don't apply a big tape all across, and you've got beard growing. So the beard ingrows the tape, and then yeah, there is some
No,
pain.
it was alright.
But otherwise, the pain factor, I'm saying immediately after surgery, day one,
Nothing
day
that
two,
much, nothing that
was
much.
comfortable.
Like out of 10, I would rate it like 4.
Four.
4
Okay,
5.
so
It's quite bearable.
bearable type of pain. Okay, that's
After
nice to
2
know.
3 days, it's like nothing.
Nothing after
It's just
2 days.
like something is like a tad
Heavy.
heavy.
Okay, and how much of numbness are you having right now?
Quite a bit.
Quite a bit of numbness, yeah. So the numbness will be there initially, the entire area, then slowly it will wear down. Within a month or two, it's going to be totally normal. And this happens especially when we're doing large movements of the chin, because then I'll make the mental nerve more free.
Sure.
So that causes some transient paresthesia
Sure.
or temporary numbness.
Sure.
And this is definitely going to resolve, so nothing to worry about. But during that time of temporary paresthesia, don't have anything very hot, social also. When you go, sometimes you can have the kind of feeling of dripping of fluid and all that. That will be there, but eventually it'll all settle down and it'll be fine. So you leaving tomorrow or today?
Today I'll be leaving today evening.
Today evening. Okay, so safe journey.
Sure.
And take care.
Thank you.
And
Doctor.
let us
Really
know.
appreciate your help.
You're welcome.
Always been very kind.
Yeah, take care. Bye. Just see, you can remove all